It is with great pleasure that I introduce Dr. William Ray, the founder and director of the Environmental Health Center in Dallas, Texas, one of the only clinics in the world to both recognize and treat electromagnetic field sensitivity. They've also treated people from the Alaskan oil spills, Desert Storm, 9/11 victims, and those individuals who have become ill at home or work from exposure to carpets, paints, pesticides, solvents, formaldehydes, and many other chemical agents. A thoracic and cardiovascular surgeon with a passionate interest in the environmental aspects of health and disease, Dr. Ray has received numerous professional honors, including being named to the world's first professional chair of environmental medicine at the Roberts Institute of Technology at the University of Surrey in England in 1988. Named International Man of the Year in 1977, Dr. Ray has treated over 40,000 patients from all over the world who experience symptoms from environmentally induced causes. And for you Ohio folks, of which I am one, he was born in Jefferson, Ohio, and graduated from Otterbein College in Westerville, Ohio, and Ohio State University College of Medicine in Columbus, Ohio. So much more to know, but I'm looking forward to picking his brain. So welcome to the show, Dr. Ray.
Thank you very much.
Such a pleasure to have you here. We know that many common ailments may be traced to substances that we're exposed to in our everyday environment. What are the main environmental challenges to our health?
Well, the two most common that we find are the pesticides and the natural gas fumes. As you know from the Midwest, the corn and the wheat and all the different grains are sprayed with herbicides. According to statistics, that the state of Iowa has the highest cancer rate compared to the chemical dump areas in New Jersey, which are, of course, for New York City and everything. So those are equal now. So it's ubiquitous in the environment. And then, of course, there are also big city solvents, car exhaust, carbon monoxide, ozone, particulates, sulfur dioxides, city air pollutants for diesel trucks and cars. And then, of course, there's the electromagnetics, which is now a new epidemic in America because so many aerials are being built in all the different areas for the Wi-Fi.
Absolutely, and I want to go there today. There's just so many topics we can talk about, but that's what's been on our mind lately. So with your permission, I'd like to talk about that double-blind study that showed that certain individuals can be extremely sensitive to EMF. If you can share the outcomes of that.
Well, there's just absolutely no question about it. We study where we selected patients who were complaining of electrical sensitivity. You know, they complained of the Wi-Fi, telephones, portable phones bothering them, and we put them in the room and actually de-adapted them so that they were symptom-free, and then we challenged them with placebo and with the different frequencies and found that we could trigger the electrical sensitivity and cause them to have illness. The other thing we found was that 80% of the patients also had a chemical problem, which was the electrical part was built on top of the chemical problem. So if you didn't address the chemical problem, it wouldn't get better.
That's interesting. So the one exacerbates the other, correct?
Yeah, it seems to be. Now, there are about 20% who seem to just have total electrical sensitivity and no chemical problems, but they're certainly in the minority.
And you found correlations between EMF and blood pressure, EMF and cataracts, and just so many other symptoms and problems.
Yes, heart irregularities. Mm-hmm. The EMF seems to give the autonomic nervous system, which is your automatic nervous system, which goes to your heart and your blood vessels and your intestines and also your brain. There seems to be what we call a sympathetic surge from that. That means an adrenaline surge. The block of that, the parasympathetic nervous system, seems to be decreased in about 60 to 80% of the patients.
And there's been to date about 8,000 military studies done from way back when that prove this, and yet it's being covered up, and people are still wondering what their symptoms are all about and being misdiagnosed and mistreated. I want to talk about cell towers near schools and how that's causing cancer to rise, and the wireless devices in schools that are causing children's IQ to drop. I know you have something to say about that.
Yes, as Dr. Milhelm out in California has done some beautiful studies in which he showed that if a tower was near a school, the teachers had a 20% increase in cancer each year, and the kids' IQs dropped 5 points each year. Well, I mean, that's staggering when you think about that. Is there any reason why our kids should be dumb? Well, we don't want that. We want them to improve their IQ, don't we? And improve their ability to remember and ability to create. I see them all over Dallas, which are in that area now. And that's only occurred in the last couple of years.
Right, right. We're going to be interviewing Dr. Sam Milham next week. And
good.
Yeah, I look forward to that conversation with him. I mean, the cell towers are ubiquitous. They are everywhere, and now that's mandatory with the Wi-Fi in the school. And you talk about dumbing down our children. Well, if these studies are showing that, why aren't people paying attention?
That's been the big thing for me. You know, for some reason, the effects of the environment have been covered up in the press and in the education systems of America, particularly the universities, for the last 30 to 40 years, because we've worked on these studies, both the chemical and electromagnetic, for about 35 years, 40 years, and there's no question that it influences the body. Mm-hmm. And the other thing, I'm a heart surgeon, and I've shocked hundreds of people back to life. Because you need to have an electrical impulse for them to work properly, right?
Right.
Well, that's been known for 50 years. Mm-hmm. And so we know that electricity affects the body. And we also know that from the bypasses in the heart and lung machine, and if you get too much oxygen, which acts like ozone, you'll get what's called a respiratory burst, and the patient can go into shock from that. Mm-hmm. So, I mean, it's not like that there was new information. There was great information which has been sort of somehow suppressed, and then all this new information is built upon it, you know.
Right.
So I don't know why that is, but it's an enigma to me, because supposedly academic institutions which do the teaching are supposed to look on the new ideas and get them. But, I mean, some of these are old ideas with tons of documentation, and what I keep hearing all the time is there's no documentation. Well, that's just pure baloney.
Right. Right. That's what I said. There's over 8,000 studies already done. So when people clamor for more research, that's a stall tactic. There's no need for more research. It's out there. And everyone wants to treat the symptom and not the cause. And even in schools, they're installing defibrillators because kids are, having heart palpitations and heart problems.
Which is, of course, ridiculous.
Yeah.
Because we do know what causes it.
Right.
See, that's the problem. And why have we had to have that now when we never had to have it before? I mean, kids didn't have any cardiac arrest, you know. I mean, it's ridiculous.
Yeah, it's pretty darn scary, actually, and we need to do something about it fairly quickly. I want to talk about your clinic, because what you do there is, as far as EMF and actually all toxicities, that the symptoms can be reduced by controlling the environment. What person or who should seek your consult and seek your services?
Well, I think anybody who doesn't have a solution to their problem immediately. Mm-hmm. You know, our average patient has gone through the Cleveland Clinic, the Mayo Clinic, 20 doctors, and had no help. Well, that's waiting too long, you know, and it should be people who can't, if they find a doctor and the doctor doesn't want to look at the cause, then they need to come here, you know, because we look for causes.
Right, and it could be any host of symptoms that are just simply going undiagnosed too long, correct?
Yes, that's right. I mean, look, chronic fatigue and weakness, that's one of the main first symptoms of pollutant injury, okay? So how many people that have this chronic fatigue and weakness have been looked into the cause? And, of course, if it's not a bacteria or viral, people just ignore it. Mm-hmm. And that doesn't solve the patient's problem at all.
Right, just throw some drugs at it, right?
Yes, and of course, what happens is they suddenly will start getting refractory to drugs, and they can't tolerate any medication.
Right.
And then everybody throws their hands up and says, well, we don't know what to do, you know? Well, that's where your controlled environment comes in and where you can decrease the load. See, all our environment, both the living quarters and the clinic, is 5 times less polluted by chemical analysis and particulate analysis. And so we know that it's much less polluted than the average area, you know.
Yeah, I saw that you offer a less toxic housing option where the patient's isolated from outside environmental factors, and that the units have been designed to eliminate exposure to any offending substances.
That's right.
Yeah.
as much as you can in the city, you know. And this really makes a big difference because a lot of people will then start clearing up, and pretty soon they'll get into their area where they disadapt and they don't get used to something anymore, and they can prove cause and effect. And a lot of it is we don't have to tell them. Well, look, they'll tell me, hey, boy, when I cleared up, this bothers me. You know, a perfume will bother me now, or pesticides will bother me, or et cetera. And they can give you, well, it decreases my migraine headaches because it caused the migraines, or it caused my heart irregularities, or it caused my bloating and food sensitivity, you see, or whatever it is.
Yeah, you mentioned an adaptive phenomenon where you just kind of get used to the problem and consider it, oh, well, I must be stressed or something else, and not really looking to find out.
Yeah, I think that's the other thing is you got to realize that a lot of this is pinned to stress without any scientific data, whereas with the environmental things, you can prove cause and effect, which is a lot better to do, you see. Mm-hmm. And, you know, everybody gets a little bit stressed sometimes, but that's not the issue. The issue is what is going on in the brain and what is going on in the communication systems of the body that to trigger that, you see. We see this all the time. Well, we can't find anything wrong with you, so go see a psychiatrist.
Right. And how many folks has that happened to? I know just one of the co-hosts of my radio show, he has an extreme sensitivity to EMFs, and his record says that he's delusional. Well, yes. That's not solving any problem.
Without any proof, right?
Exactly. Just because they don't want to admit or look into or figure out what's wrong, well, the patient must be nuts.
Right.
Yeah.
Yeah, we see that frequently.
I'm sure you do, and I'm sure your doorstep is probably a last resort for so many people when it really should be the first.
Well, you're exactly right. Unfortunately, it's true. And I draw patients from all over the world, and the same thing happens every place. Mm-hmm. That they've been through all the docs, and some of them get so they can't eat any food. They're super sensitive to food. You know, They lose weight. They really have severe fatigue and weakness because of that, and their nutrition gets screwed up because of that. It's too much demand on the detoxification systems. And therefore it's overutilized, you see, mm-hmm. and therefore you get nutritional deficiency.
Right, and once that happens, you can't heal at all. Explain the process then, should a person decide to come to your clinic. How does that work?
Well, of course, what we do is usually place them in a controlled environment for a period of time, and as soon as we can start testing them after a good history and physical, we have to do that first, you see. Then we... we'll go ahead and try to prove cause and effect. If they're real food sensitive, of course, we'll give injections for the right doses of foods until they can tolerate foods. If they're mold sensitive, we give them injections for the molds. And if they're chemically sensitive, we may give them some injections for them. And we may give intravenous nutrients, and we give oral nutrients like vitamin C, glutathione, multi-minerals, multivitamins, and so on, so that they can start getting their energy back and get a program where they can weave through society with cause and effect, because they now are clear enough that they know, hey, this area bothers me, this area doesn't bother me, this thing bothers me, this area doesn't bother me. And they can use their own body's own receptors for this, you see, which is, of course, I think that's how we were designed.
Now, do folks stay in these housing units for a period of time, or can somebody just come in and be evaluated and go home with your guidance as to how can they clean their environment at home?
There are three groups, of course. The first group never comes into the living environment because they live at home, you see. Mm-hmm. And those are local or semi-local people within a couple of 100 miles. Then there's another group who has to live in the controlled environment for a period of time, usually a week or two, although we've got some people that are there for 6 months to a year, because they're so wounded. So it's a whole spectrum. Most people just come in because they're feeling bad and feeling fatigued and they can't tolerate medication, and we work them out from home. And, of course, one of the problems, as we said, is pesticides and natural gas. And, of course, it's harder to work those people out at home if they've got natural gas or if they have pesticide in their house. The other big problem is the houses. So many of them are getting moldy now that people have to move out of the moldy house, you know.
A lot of causes here. Now, you talked about the controlled environment. So even down to the water in the showers is filtered, and the furniture, the floors, the ceiling, everything is as clean as possible. How can someone possibly recreate that at home?
Oh, I mean, we've had thousands of people do that now. They can get water filters, you know. There are certain ones that are really designed very well for that. They can eat organic food. We like on the drinking water either good glass bottled spring water or some double filtered water or distilled water, you see. And so they can do that at home. And you eat organic food, and you got to have a variation of a diet. You don't eat the same thing every day. You have what we call a rotary diet, where you eat the same thing only once in 4 days, you see. And then a lot of people have to take up their carpets or a lot of pressboard plywood cabinets. They have to go ahead and foil those with aluminum foil to keep the formaldehyde from coming into the air, and so on.
Wow. Now, in your controlled environment area there in Dallas, now are there cell towers located nearby?
Unfortunately, they are. They didn't used to be. They just put them up in the last year.
Yeah. Now, how do you fight that within your facility?
Well, see, my real clean side we designed about 30 years ago is sand fused on steel at 2,000 degrees. So it's a porcelain metal shielded, and all our window blinds are made out of aluminum, and therefore that will shield it.
Excellent.
And of course, we made one gross mistake when we built this. We put in fluorescent lights, which were changing it incandescent, and we also are in the process of putting in some of the Stetzer filters and some of the other filters that to get rid of dirty electricity. But it's like I said before, it's totally clean, about 5 times less polluted for chemical and particulate.
Now, sticking with the EMF topic for a moment, so when folks come to your clinic, I'm sure they're bringing their cell phones with them. Do you allow that in the controlled environment or even in your office?
No.
Okay.
We do not. And we have no computers on the side, our most sophisticated side.
Well, I mean, it's easy to hardwire things, right?
Well, yes, and that's the alternative for all these towers. Is I think Chattanooga, Tennessee, has elected to use fiber optic cables and not use cell towers. Well, why don't other people do that?
You mentioned that to me before, and I looked that up, and that's huge. I mean, they've got companies moving from Knoxville and all over to Chattanooga not because of the health aspect of it, obviously, but because they're thinking, wow, the fiber optic delivers the internet faster, and so businesses are moving there. Not only is it faster, it's cleaner. It might be a little more expensive in the beginning, but wow, for speed and ultimately for health, why isn't everyone looking into that?
Well, that's my question.
Yeah.
I wonder that, and I think you should, your listeners should take that into consideration and see if they can't push for that.
Exactly, on a local level. Now we're talking about cell phones. What do you think about secondhand phone? You can't even go anywhere maybe you don't own a cell phone or use one, but you're standing in line anywhere, and now you're getting bombarded by somebody else's.
Well, that's true, and a lot of people will complain about that to me, that they get sick from somebody else's,
And then there's dental implants and metal prosthesis and body implants. Let's just talk briefly about that.
Well, that's one subject we haven't covered yet, you see. But there's something like 220 different implants now. And so people with teeth like mercury amalgams, or even the acrylics, the composite ones, can have trouble with it. Last week I've seen 3 people who've had tooth implants, and of course they're titanium on the enamel, and they're sensitive to it. We see people with jaw implants of silicone who have problems, breast implants, fractures. A lot of the orthopedic procedures, they act like antennas, and these are steel and titanium titanium alloys, which has a lot of nickel in it. And then there are the other type that are used for internal areas like the intestines and the hernias, the polyurethanes and polyvinyls, and these people can increase their total body pollutant load and have problems with those. Now, a lot of those we can neutralize with our injection therapy, and that works very well. but some of them you can't. And some things can be removed, some can't. For example, I had a lady who had a pacemaker put in, and she reacted to the metal in the pacemaker, and she was worse off than beforehand.
Mm-hmm.
We were able to neutralize her, and she did well for 2 years, and then the pacemaker failed. They put in a new one, the same thing happened, but we did lucky enough we were able to neutralize all the metal and all the stuff that was in it, and she's been 5 years more, so she's got total 7 years of neutralization, and of course decreasing her environmental load also. So there you are with that. You've got to think about antenna effects of metals in humans.
And that's important for folks to think about the antenna effect. But then, as you mentioned, you try to, say, get rid of the mercury dental fillings. That has to be done with extreme care because that mercury is extremely toxic. And I know that even the dentists and their hygienists are wearing hazmat suits, basically, if they're doing it properly, because of the toxicity of that. So if someone's looking to get those fillings removed, they need to make sure they're going to a certified dentist that knows how to properly remove them.
I agree with you. And the other thing is they need to be tested on what they're going to put in because they can get out of the frying pan into the fire.
Mm-hmm.
Some of these I've seen, so I've seen them put in composites, and they had those are acrylics usually, and they had problems with that, or silicone. And so, they're usually gold or porcelain are the two best.
Okay.
And that seems to be the safest that we can tell.
All right, that's good to know, gold or porcelain. And then as you're talking about metal in the body, then think of the chemtrailing that's going on with all of the aluminum and barium and selenium that they're dropping from the skies on us that are affecting us, our food supply. So,
yes.
We may not...
Why are they doing that?
Why are they doing that?
Yeah.
That's an interesting... that could be another show, right?
Yes.
Oh my gosh. Well, I know there's so much more we can talk about today, and I know you're short on time because you've got patients to see. Well, do you have any final words of advice for our listeners today?
Well, I'd say be aware of your environment. It's not all genetics. As a matter of fact, genetics are just the mechanisms that allow somebody to react, and nothing occurs by magic. You've got to have an environment to trigger it. And look for the things in the environment and listen to yourself.
Right. So if folks are listening to this and they're thinking, whoa, the light bulb goes off and they're thinking, I need to look into this, where can folks find more about you and what you do, and how can they contact you?
Well, I think we're on the internet at ehcd.com, and then our phone number is 214-368-4132. And Sue is our intake gal, and she can help information, and so can the nonprofit foundation, the American Environmental Health Foundation.
Okay.
They have a lot of goods and services to help these people.
All right. So, folks, the Environmental Health Center Dallas looks beyond the ordinary to find reasons for illness. They investigate all the possibilities which can affect a symptom response, from heredity to home and work environment, from allergen to toxicity, and from immune parameters to nutritional deficiencies. Assessments will be made according to you, your lifestyle, and your unique environment. And I encourage anyone who suffers from symptoms with no solutions to visit the website ehcd.com, ehcd.com.